My name is Esther Sharp. I am 33 years old. I work in retail in Birmingham, so it's very customer focusing, very face-to-face. I've probably been coming here for 12 to 15 years. I actually quite find it relaxing in the dentist chair, which I think Amit thinks is a bit strange, but he likes it. So how my journey began with implants is I'd had a lot of work on my back teeth with fillings and stuff due to my own fault of having a very sweet tooth at a young age. So I started to have a lot of work done, but then some of the fillings I felt were very dark. The older I got even more conscious because everyone wants the perfect smile. And then it got to the point that one of the back teeth that I've had work on, it actually couldn't be repaired anymore. So it got extracted and I was left with an enormous gap. When the gap was at its worst, I couldn't really eat anything that was hard or crunchy because it was actually cutting the gum, and I noticed myself stop smiling as much or as wide. We couldn't go down the route of having a crown or anything because the tooth next to it wasn't strong enough. I was changing my diet and I couldn't eat the stuff that I loved, and it just kind of made me realise, what am I doing? So that was the opening to why I had the first implant on the left side. It was a very big decision. It's not cheap treatment, but what you are paying for actually is quite remarkable for what they can do. It's definitely worthwhile, and I've valued it so much that I had the other side done to kind of balance it. So how it feels now, I don't even notice it, if I'm completely honest. Initially in the first couple of weeks you are aware of it, but it's only because your mouth is used to where the gap was. Amit was really patient with my OCD overdrive, and I came back numerous times and he said, "Es, just let your mouth adjust." And within, I think it was about 2 weeks, I didn't even notice it, but immediately I noticed that I was smiling more like myself. I was proud of my teeth. The colour match was incredible. No one would notice unless I actually told them. It was definitely one of the best decisions I've ever made. Financially, yes, you do have to become accommodated to it, but when you weigh up the pros and cons of your self-confidence and your mouth being in no discomfort at all, it's a completely no-brainer. It was the best thing I've ever done. It's just given me that boost of confidence again, and also there's no discomfort. But the great thing is that I know that if I did ever have any discomfort or anything felt different, I know that I could pick up the phone and Amit would get me in that very same afternoon. He is probably the most patient dentist or professional that I've ever actually met. And I only say that is because I am notorious for having worries about my mouth that are actually only in my head and nothing to do with anything in my mouth. But instead of just brushing me off, he agrees to see me. His energy around him is everything that you would want for someone to be in charge of your health and hygiene.